Colorectal polypectomy and endoscopic mucosal resection, EMR, European Society of Gastrointestinal Endoscopy, ESGE Clinical Guideline. The endoscopic removal of colorectal polyps reduces the incidence and mortality of colorectal cancer, CRC, and is considered an essential skill for all endoscopists who perform colonoscopy. Various polypectomy techniques and devices are available, their use often varying based on local preferences and availability. This evidence-based guideline was commissioned by the European Society of Gastrointestinal Endoscopy, ESGE. It addresses all major issues concerning the practical use of polypectomy and endoscopic mucosal resection, EMR, to inform and underpin this fundamental technique in colonoscopy and in CRC prevention. The diverse topics covered in this guideline include the classification of colorectal polyps, the optimal evidence-based approaches to polypectomy for polyps of all sizes and morphologies, colonic tattooing, a guide to effective and safe EMR for large sessile polyps, the role of advanced imaging in polypectomy, and which lesions require the involvement of expert centers or more complex interventions such as ESD or surgery. Technical aspects such as equipment and auxiliary devices to optimize polypectomy are also discussed. The guideline defines the key adverse events during and following polypectomy, the recommended management of adverse events, and the need for audit of outcomes to monitor quality and safety of polypectomy and EMR. Finally, guidelines for the histological evaluation of resected polypectomy specimens and practice recommendations for high-risk histological features are discussed. Throughout this guideline, areas where further research is required to answer critical questions are highlighted, providing direction for researchers to design further studies. This guideline does not address management of anticoagulants and other medications in the peri-procedural setting, nor post-polypectomy surveillance or quality measurements, as these are addressed in separate guidelines. This guideline is an official statement of the European Society of Gastrointestinal Endoscopy, ESGE. The Grading of Recommendations Assessment, Development, and Evaluation (GRADE) system was adopted to define the strength of recommendations and the quality of evidence. Main recommendations. 1. ESGE recommends cold snare polypectomy, CSP, as the preferred technique for removal of diminutive polyps, size less than or equal to 5 mm. This technique has high rates of complete resection, adequate tissue sampling for histology, and low complication rates. High-quality evidence, strong recommendation. 2. ESGE suggests CSP for sessile polyps 6 to 9 mm in size because of its superior safety profile, although evidence comparing efficacy with hot snare polypectomy, HSP, is lacking. Moderate quality evidence, weak recommendation. 3. ESGE suggests HSP with or without submucosal injection for removal of sessile polyps 10 to 19 mm in size. In most cases, deep thermal injury is a potential risk, and thus submucosal injection prior to HSP should be considered. Low-quality evidence, strong recommendation. 4. ESGE recommends HSP for pedunculated polyps to prevent bleeding in pedunculated colorectal polyps with head greater than or equal to 20 mm or a stalk greater than or equal to 10 mm in diameter. ESGE recommends pre-treatment of the stalk with injection of dilute adrenaline and or mechanical hemostasis. Moderate quality evidence, strong recommendation. 5. ESGE recommends that the goals of endoscopic mucosal resection, EMR, are to achieve a completely snare-resected lesion in the safest minimum number of pieces, with adequate margins and without need for adjunctive ablative techniques. Low-quality evidence, strong recommendation. 6. ESGE recommends careful lesion assessment prior to EMR to identify features suggestive of poor outcome. Features associated with incomplete resection or recurrence include lesion size greater than 40 mm, ileocecal valve location, prior failed attempts at resection, and size, morphology, site, and access, SMSA, level 4. Moderate quality evidence, strong recommendation. 7. For intraprocedural bleeding, ESGE recommends endoscopic coagulation, snare tip soft coagulation or coagulating forceps, or mechanical therapy with or without the combined use of dilute adrenaline injection. Low quality evidence, strong recommendation.